that you have given us this opportunity, and thank you that you are always with us despite the circumstances. Amen.
Amen. If I could ask everybody to please mute. I didn't do that initially, and I apologize. But you have given us this opportunity, and thank you that you are always with us despite. And what I'm going to end up doing here in a second is trying to get rid of my streaming. If I could ask everybody to please mute. At this point, let me just do a little bit of housekeeping real quick here for everyone. You all hear me? Okay. First of all, ladies and gentlemen, we do have a very short schedule today. Instead of session starting at 11, which it normally does, we're going to be starting at 10. And I think we're going to be losing a lot of delegates and senators so they can get to meetings. And we are at that crossover time, so it's a little bit hectic. I'm going to ask our presenters if they could possibly shorten their presentations as much as possible, be as brief as they can, just so we can get through the schedule. But I also do have something for the body. What we're trying to do is we have that certificate of need letter for our healthcare people, Heather Guerreri's group, hospice. What I'm going to ask you to do is we're going to tighten the letter up. And what I'm going to look for here, hopefully, is for us to get through this and say that we can tighten the letter up, and then I'll do a vote via email, if that's okay with everyone. Okay, I'm going to probably need a motion.
So moved.
Second.
All those in favor, say aye.
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 Okay. What I'm going to ask everybody to do right now is if we could get right into our agenda. Oh, I need an approval of the minutes too. I'm sorry.
So moved.
Okay. So, all those in favor, say aye.
Aye.
All right. We're going to start off real quick here. I think we have our Eastern Shore Behavioral Health. Katie.
Good morning, everyone. Thank you, as always, for inviting us once a year to join you all to present on our Eastern Shore Behavioral Health priorities for the session. So we've got a very large group represented here this morning. I wish we had the time to go through and do proper introductions, but I will just express our gratitude on behalf of the Eastern Shore Behavioral Health Coalition for this opportunity to join with you all. And of course, recognize your leadership and your support with the advocacy of our provider network and our consumers of behavioral health services here on the Eastern Shore. We do have a handful of hot topics and top priorities that we'd like to move through, and hearing that we're on shortened time, I will be handing this part of the presentation over to our first group that's on the agenda. That we've offered today. Hopefully you all have had the opportunity to see the materials that we've shared. If not, I'm happy to share my screen if that would be helpful. But our first presenters, plural, Bill Webb and Carla Thorpe, they do have a brief PowerPoint that they'll be referencing during their presentation. So I will hand that over to Bill. And if you need us to share the screen, we certainly can, if that would be helpful. But of course, again, we really appreciate this opportunity to gather this morning and are so grateful for the opportunity. All of our membership organizations that are part of our group are referenced on our agenda that we offered, so you can see who is part of this advocacy group. And again, thank you so much. So with that, I will hand it to Bill and Carla.
Okay, thank you, Katie, and thank you to all of our elected representatives. Thank you for hearing the story today. I'm going to be as brief as possible. As you may be aware, the Maryland Department of Health announced that it will be divesting ownership of the Upper Shore Community Mental Health Center in September of 2026. Of March of 2026. And we need to come up with a solution for how we're going to continue using that facility. At this point, the state has offered the facility back to Kent County. It is a vital facility for mental health services, not only in Kent County, but for addiction services on the entire Eastern Shore. We provide critical, addiction services for our Medicaid and uninsured population. And at this point, we recognize that it's a 40-year-old building that needs some substantial renovations. And we also benefit significantly from the Maryland Department of Health through its annual subsidy. I have a number of timelines and background details that are in the PowerPoint presentation. I encourage you to review those as much as possible if you have questions. And for the sake of brevity, I think that what I want to do is just brief everybody where we are. We have a couple of strategies that we can follow. One, we can try to convince the Maryland Department of Health that this facility is being actively used by the Kent County Health Department and the Maryland Department of Health, because they currently do not consider it. They consider it closed, but it is still very much being used. So, our first strategy would, can we convince the Maryland Department of Health to take it off the divestiture list, and can we, get the department to invest in capital renovations that are desperately needed? The second alternative that we are exploring is having a coalition of midshore counties take ownership of the building. That's sort of, new and uncharted territory for the groups. And we are currently reaching out to the counties to see what their various interest levels are. We will be holding open houses and further meetings later this spring and summer so that we can include our elected representatives. What I can advise is that this is a vital resource, and that if we do nothing about this, it will go away, and it will be significantly detrimental to the mental health services on the Eastern Shore. And I will stop there.
And we did prioritize, our topics by order. So this is definitely something that is a very sensitive topic for our group in the Eastern Shore. So if this group would be interested in Bill returning for a more in-depth presentation, I'm sure that's something that we can be available to do and have a more in-depth conversation and Q&A, and even sort of a strategic planning discussion. So we're certainly open to that, because this morning we may not have time for questions. So I just wanted to offer that. And so next up, we've got, I believe Dr. Seifert is going to be presenting to the group on the Behavioral Health System Modernization Act. So I will hand it over to Dr. Seifert.
Good morning, everyone. Thank you for being here. Behavioral health is near and dear to my heart for many years. And so I wanted to present to you the Behavioral Health Modernization Act and what it means and what it could create. It creates effective and coordinated behavioral health services, which are needed more than ever in our complex and difficult world. A history of well-intentioned but piecemeal fixes for behavioral health has left Maryland's behavioral health system disjointed and lacking continuity, efficacy, comprehensiveness, and efficiency. What is needed now is to move forward towards coordinated care for all people seeking mental wellness, freedom from substance abuse, and reduced involvement with the criminal and law enforcement system. Here are the elements: increased comprehensive community-based treatment by expanding Maryland's network of well-researched and highly effective certified community behavioral health clinics, CCBHCs. It provides for improved health outcomes and treatment quality by expanding the delivery of individualized, data-driven, and measurement-based care in behavioral health settings, and by enhancing care coordination with primary care settings. It strengthens the behavioral health workforce by expanding resources and support for peer support networks and certified peer recovery centers. It also provides for improved care for children and youth, with behavioral health needs by increasing the availability of home and community-based wraparound services, severely needed for our really complex kids. It provides reduced reliance on law enforcement and emergency departments by enhancing Maryland's network of crisis call centers, mobile crisis teams, and crisis stabilization facilities. Passing the Behavioral Health Modernization Bill will improve Maryland's behavioral health system, so that it creates a higher level of quality, effectiveness, and efficient service delivery. Let's reduce the pain and agony of addiction's destruction of lives, the horror of criminal recidivism, and the danger from severe and chronic behavioral health problems that destroy people and families. The Behavioral Health Modernization Act moves Maryland into a modern, collaborative, and effective system of care. Thank you very much for listening.
Thank you. Next.
Okay, next up, I will be co-presenting with Lori Doyle from the Community Behavioral Health Association of Maryland on Senate Bill 549, House Bill 715, which is a bill specifically discussing our administrative service organization. So otherwise referenced as Optum Maryland, which might be more familiar to this group. So I will start with having Lori overview sort of the synopsis of the bill and the potential impact. We did have a provider that was going to share some testimony around specific fiscal and hardship that the Optum process and the reconciliation process has had on her organization, but I think she's running late. So we will move on. So Lori, thanks for being here.
My pleasure. Good morning, everyone. As Katie said, Optum Maryland was hired in 2019 to be the vendor to process authorizations and pay claims in the public behavioral health system. They went live January of 2020, and their system immediately crashed, forcing the Maryland Department of Health to give advance payments, or what are called estimated payments, to providers to keep them afloat. Providers continued to bill for services rendered, but were paid by these estimated payments. And of course, that period also was at the same time that COVID hit in the beginning. So now, 2 years after the fact, this period from January 1 of 2020 through August 3rd of 2020, we're trying to reconcile what do providers owe back, if anything, from this mess that occurred. And Optum's system is so dysfunctional that it's very difficult to get to that answer. It's the best analogy I can make is like getting a credit card bill. None of the charges you made are itemized, nor are any payments you made reflected. So you're just left with a total with nothing to show how that is backed up. So we are very worried that if the General Assembly doesn't act on this bill, that we will be left at the whims of this vendor to say, well, we don't care, you owe this money. We provided the services in good faith during a very difficult time. We should at least be credited for those services and the reimbursement that should have come along with them. This is not only a policy issue that's in HGO and in finance, but it's also a budget issue. So those of you on the budget committees, we're trying very hard to get strong language that says that they can't take back any money until they re-adjudicate these claims that are sitting in their system, and also asking for some debt forgiveness for the impact of COVID. And I hate to use the word forgiveness, because providers didn't do anything wrong here. We're just saying, we need help through this difficult time with a vendor that didn't live up to its promises. So that's it in a nutshell, and thank you for your time.
Thank you, Lori. And it looks like Heather has joined us. Heather Collins, are you here?
Yes, I am. Thank you. 2 years in, I'm still having Zoom trouble, which is funny. Yes, we're a provider on the Eastern Shore. We have locations in Cambridge, Salisbury, and Princess Anne. And like many providers, we've been struggling with Optum. We still continue to struggle. And the amount that they're saying that we owe is hugely incorrect. And we have spent dozens, if not hundreds of hours trying to balance out the numbers. They are not doing the work. They are asking us to do the work. We are a small provider. We don't have extra resources to apply to look at the spreadsheets that they send to us and try to show them that the services we provided were valid services and should be paid. Right now, I've had an outside contractor work for us because we couldn't allocate the time to do that. The most recent spreadsheet they sent to us, we had asked for denials because that's the bulk of the money that they say that we owe them. The spreadsheet was 85,000 rows long, and it was not sorted in a way that you could get any valid information from it. I again had to have a contractor help me with that. I'm very skilled at Excel, but I was not able to utilize the data they gave me. So I had an outside contractor help me with that. It took him 3 hours to be able to extract data from that would be useful. The data that I extracted from that spreadsheet over the course of 2 years and 2 months, we had, they're telling us we owe $306,000, which candidly might put us out of business. When we manipulate and extract the data from the most recent spreadsheet, they owe me $8,000. And they're asking me to prove to them that I am correct and that we have provided the services that we provided. And the resources they provide to us are people that we meet with every 3 weeks or so. And they say, hey, go do this work and get back to us. They want us to actually call the customer service line and challenge claim by claim by claim. Right now, I think it's more than 5,500 claims that would be. I'd have to hire 2 full-time people to be able to do that. I can't do that. So this is a critical issue, and we beg that it be resolved in a way that allows us to continue to provide services in 3 counties on the Eastern Shore.
Thank you, Heather. Thank you very much. Next up, we have Beth Ann Langrel and Kathy Castle will be presenting on the Eastern Shore Behavioral Health Capacity, Workforce, Retention, Recruitment, and our rural needs. So Beth Ann and Kathy, you're up.
Hi, everybody. Thanks for being with us today. As I'm sitting and listening to Bill and I'm listening to Heather and Katie speak this morning, and Dr. Seifert, it occurs to me that we are spending a lot of time trying to solve issues that if they were out of our way, we could do the work that we are all here to do, which is serve people. And, when I think about Bill and the fight that is going on right now to be able to save addiction services, I do want to add in that not only do they serve the Medicaid population and the uninsured population, but we as a provider rely on the staff at Bill's organization to be able to help connect people with insurance to addiction services as well. And I think that's a really important piece that we can't forget, that just because our clients might not be able to be served there, it still doesn't mean that there's not a valuable resource that we rely on as providers. I certainly think as we're talking about workforce retention, we're in a crisis with mental health workforce. There simply are not enough clinicians to go around. We are facing, and Addie has been wonderful about helping navigate some of the problems that we're finding alongside the Board of Nursing and with credentialing. When the Department of Health has gone completely to paper, we had a psychiatrist that was ready to go back on February 1st. It took us until the 14th of March to be able to get her licensed in the state of Maryland, even though she had quit her job and was just sitting idle for 6 weeks. When there's a wait list of 100 people at our agency waiting for services, it's an atrocity that we've got folks who need to be served and we have the people to do it. And there's a backlog in licensing and credentialing. The other piece that we face on the Eastern Shore is a workforce issue and being able to pay folks enough, when there are private practice practitioners that are being paid $75 and $80 an hour. We simply don't have the reimbursement rates at a level that we need them to be at in order to sustain workforce and be able to pay them what they're looking for. So my plea today is that, we have worked really hard over these last few years. Jeff Greist and I successfully passed House Bill 829. We are still fighting through issues with some of the insurance companies from that bill to be able to make sure that all licensed practitioners can see our clients in the state of Maryland. I am just really asking that when we look at the workforce, I was on a call with Senator Cardin's office a couple of weeks ago, and mental health was referred to as there's a bill on the other side that we are looking at when we were talking about healthcare. Our mental health facilities are absolutely a part of the overall healthcare and wellness that we provide in the state. We can't keep mental health as a separate conversation anymore, because the bottom line is when folks are leaving their jobs, when places are not operating well, they're coming to our agencies to have the support that they need. And our outpatient mental health clinics are now being forced to operate more as quasi-inpatient clinics because there simply just isn't enough resources to go around. So as you think through, the bills and the budgets and the workforce and reimbursement rates and what Heather's talking about with Optum, we don't have enough staff as it is to meet the needs of the community. We certainly shouldn't be having to spend our time chasing our tails to prove the services that we have done in good faith to our community through a community crisis. And Kathy, I don't know if you have anything else that you want to add as well.
I do. Thank you for having us, you guys. I know you're on a time crunch. I'll just keep this simple. I've worked in this business at my agency actually for 31 years, and this is the first time that I've been really seriously concerned about workforce and can I keep all my sites open? I mean, honestly, the front level staff that we're working with, they can make more at Target and Chick-fil-A, and that's a problem when we're dealing with people with a mental illness. And because we need the workforce. It's not like we can ignore it. And, people are tired. You guys are probably hearing it all over the place. We're losing nurses. We're losing teachers. Those frontline workers they're exhausted. And it is definitely a crisis. And although we do appreciate, we are in the middle of some mandated rate increases that are kind of following the minimum wage increase. And we're so grateful for all of you for that support. However, we know inflation is going up. And these increases, maybe will help with the bringing us up to minimum wage. That's where we are right now. That's how sad it is. Some of us have had to bring those wages up to this minimum wage. That's how low they were on those entry levels. So we're having trouble with turnover and we're having a very hard time with recruitment. So we just appreciate any support you guys can give us with getting back to where we need to be to deal with our citizens with their mental health. Thanks.
Thank you, Beth Ann and Kathy. Our final presenter this morning is Dr. Bill Fluke, and he's going to be presenting on some child and adolescent initiatives, which is also a population that, as we're seeing with the impacts and outcomes of the COVID-19 pandemic, is an extremely critical population that we need to be paying lots of attention to and ensuring that resources are available, adequate, and accessible quickly for this population. So I will hand it over to Dr. Fluke.
Thanks, Katie. One of the things that I want to mention is that we have an increasing awareness of the impact of trauma on kids. And in fact, we've been learning for a long time now that serious trauma at an early age results in not just emotional and mental problems, but physical ones as well. There's very good studies that look at a thing called ACEs, adverse childhood experiences, which show that adults who experienced serious trauma when they were very young are more likely to have physical health conditions such as heart disease, blood pressure, other issues. So one of the bills that we're looking at is going to increase our primary care providers' ability to identify these children early and refer them and help them to receive assistance. The other bills that we're highlighting are really also workforce issues. As was mentioned, it's really hard to be on the front lines, and that's particularly true in schools these days. We have a lot of really great behavioral health professionals working in schools, school counselors, school social workers, school psychologists, and it is getting harder and harder to recruit and retain these folks. There is a real critical shortage emerging for school psychologists in particular. a couple of bills introduced late in the session are going to be helping to address this if they can move forward. Any help you can provide to support graduate education and recruiting and retaining behavioral health professionals in schools will really go a long ways to being to improving the system that we've got, because the schools are providing a really substantial part of what we're doing with child and adolescent behavioral health these days. Thank you for your support.
Thank you. Katie?
So we put a couple moments in for any questions or comments from your group this morning. And I did put additional bills that we are requesting your support around in the chat a little earlier. So we just appreciate this opportunity to gather this morning. So if there's any questions for us, we can hang on for questions. And of course, if there's an opportunity to come back and present it another time, we'd be open to that as well.
Well, I'll tell you what, I'm not seeing any real questions just yet, but in the lieu of time, I think it's imperative that we start looking at some of these things and maybe put a little task force of our own together to help out with these circumstances. And moving forward, it might be better if we could focus on some of these problems as a delegation in helping it, because as we've talked before, a lot of these problems are recurring. We keep seeing them year in, year out, and apparently when we get something resolved, it's not totally resolved, and we got to stay on top of that. As far as the facility, I think that's paramount to all of us up in Kent. So we'll be working on that also. Do I have any other questions or comments from the body, or can we move to the next presenter?
Mr. Chair, and I apologize, I would have put my hand up, but my camera and all those good gadgets are not working this morning, but this is Delegate Sample Hughes. As you know, many of the bills that were mentioned are in our committee. We passed out some last night, but whoever is the leader on this, can you contact my office today? Just give me those bill numbers
Sure.
so I can keep an eye on those, because we're moving bills very quickly. And then some may be in need of assistance to be moved. So if you could help me out on that, I would greatly appreciate it.
Yes, this is Katie. I will make sure to send those to your office as soon as we're off of this call this morning. Thank you for that.
Thank you so much. Thank you, Mr. Chair.
Thank you. And briefly, Senator Carrozza. Thank you.
Very briefly, I want to thank the Eastern Shore, the Behavioral Health Coalition, for organizing this presentation. You have given us a lot of information and following along on this. I want to thank you for that, because it does help us then inform our work. And I want to also follow up on Chair Ernst's a statement about obviously we have the immediate right now, crossover week, working these issues, but we also need in the interim to work and see where we are and have things maybe teed up earlier for next session as well. See how much of this we can work out non-legislatively to help you with these backloads and with the workforce issues. So I also would offer to be part of that group.
Thank you. Senator Eckert.
Thanks so much. You know, I'd love to be a part of that group. And I just wanted to say we do have an 8% rate increase in the budget as it moves through, and we do have some measures for Optum. So hang on, we're trying to do as much as we can. Thank you.
Thank you, Senator Eckert.
Okay. All right, Katie, thank you. And everybody, thank you so much. As always, we appreciate you coming here. In lieu of that, I think we're going to move on to the next presenter, if that's okay. Thanks again.
Thank you.
All right, we have from Washington College, we have Dr. Sosolsky. Hope I pronounced that right.
You did it beautifully. Thank you so much. And I'll be very brief this morning. Thank you for the honor of addressing this group this morning. And I want to just also, it's humbling to listen to my colleagues from the Eastern Shore who are all engaged in this incredibly urgent work around behavioral health. The mental health crisis is affecting all of us. And, you know, as a new president at a really, truly wonderful college on the Eastern Shore, mental health is on my desk every single day. And we're acutely aware of these issues in the surrounding community and on our campus as well. And just please know that we stand in solidarity with you in this work. And if there's anything that we can do beyond preparing the next generation of folks who are majoring in psychology and behavioral health to be ready to join your ranks and work with you side by side, let us please know, because we really do want to be a great partner to you all in this just incredibly important public health work. So thank you. I'll be very brief, just a couple of quick things. I wanted to share a little bit of good news. The Wall Street Journal, you may have seen this last week, the Wall Street Journal listed Washington College among the top 10 colleges in the South for small liberal arts colleges, which we were very delighted to see. And my first reaction was, wait, we're in the South? Just kidding. I know we get categorized that way sometimes, but seriously, it was just such great affirmation to see that. And, one of the things that made me very happy is that the Wall Street Journal, in pulling their rankings together, they did not do, for example, what the US News and World Report will do when they make college rankings. They'll really prioritize sort of resource questions. What are the dollars that an institution can bring to bear to support their students' education? Of course, that's very important, but they were also interested in what the impact, what the return on investment was for students. And they had ways to measure that I think were meaningful. And so they ranked us in the top 10, and we're the only college in Maryland that made their list. So we were really, really happy to see that affirmation. Along the same lines, thinking about the return on investment for your education, I'm happy to report that we have the results back from the 2020 First Destination Survey. So what we do is we find out what our graduates are doing 6 to 9 months after graduation, and we track them all down in good ways. And the great news there is that among the students who graduated from Washington College in May of 2020, 91% of them are either working in a field that they prepared for, in graduate school preparing for their next career move, serving in the military, volunteering in AmeriCorps or Peace Corps, or taking an intentional gap year to prepare for the next move. 91%. So we're very proud of those kind of outcomes. That's the kind of the fruit of the labor of our excellent faculty and staff who really work hard to make sure that all of our students not only graduate in 4 years, but also have a really great launch into life after college. So that's just a little taste of good news from Chestertown and our campus. I wanted to also follow up just very briefly on the really lovely visit that Senator Hershey and delegates Aronson Jacobs made to our campus in the fall. They were touring our Center for Environment and Society. And one of the projects that our center is pursuing right now is a legislative bond initiative to the tune of $400,000 that will help us construct an instructional bird banding station on our River and Field campus. And I was asked briefly to give a quick update there. So since Senator Hershey and delegates Aronson Jacobs visited us, we have retained a builder who has updated the cost estimate that we had earlier based on final plans for the project. And the total cost, as will not surprise you, has risen a bit, 8.6% due to supply chain issues and all kinds of things like that. But it's a fairly modest increase overall, given inflation, et cetera. So we are on track to complete fundraising for the project. And if the legislative bond initiative is funded in full, we will have a balance of just $226,000 to secure. We're very optimistic that we can do that fundraising easily over the summer, and we'll be ready to break ground for that really important educational project in the fall. And that'll benefit not only our students in our campus, but also the county and the region. It'll be a great learning experience as we're able to bring K through 12 students to really understand avian ecology in a much more profound way. So I'll stop there and ask if there are any questions, but that's the update from Washington College.
Well, I can't thank you enough for coming, and I apologize for some things that's happened over the last couple of weeks, but I do want to say that I think all three of us, when we attended that, we got educated. It was one of the most interesting things. I'm just not a real big handler of those little birds, but I know the senator took charge of that. Do I have any questions or comments for the president? Well, I see none at this moment. Let me just peek. No, all good. We appreciate it. We look forward to seeing you back next year, and we'll talk to you in the future. Okay.
Thank you very much.
You, okay. Moving forward, and I'm sorry, folks, once again, for the speed we have to do this, but people will be falling off early to get to sessions. So next up, we have United Way of the Eastern Shore, Pam Gregory.
Yes, sir. Thank you. Good morning, everyone. And thank you so much for allowing Eric and I to join you today. I also just want to reiterate on behalf of all of the organizations and nonprofits who work in the behavior and mental health area. First, a huge thank you to all our colleagues on the call because your work is so very important. But I really can't underscore enough the importance of what they have all just shared with you as well. It is critical in every single sector of our community. And it is also hitting through the nonprofit community, not only from a client and meeting needs standpoint, but also for those organizations who provide those services and honestly are struggling with that in their own workforce as well. So thank you all for sharing today. And I just wanted to give my my cheerleader on that. And if there's anything that we can do to help move those initiatives forward, please reach out. Erica's going to share real briefly on a couple quick things, and then I'm going to share some data that might help continue to keep all of our colleagues as well as all of our representatives in the State House moving forward. So go ahead, Erica.
Wonderful. Good morning, Erica Joseph, everyone, with the Community Foundation of the Eastern Shore. Thank you for hearing our colleagues from your area this morning. I also want to echo Pam. When we think about workforce issues, education issues, behavioral health is impacting all of those sectors. So it's so critical to the impact in our region in so many levels. So thank you to all of our provider partners. One program I want to elevate because I know that it's getting some attention right now is oral health. We have a regional task force that's been created specifically on the lower shore, but we know that this issue, because of our work with Mercy and others, is certainly being compounded over the last few years with the impact of COVID and lack of access. But Senate Bill 150 and House Bill 06 are moving through with the expansion of dental coverage for adults. Many of the providers on our task force are highlighting the impact that will have. We know through our work that it is a critical piece of a larger, challenge to address in terms of access and number of providers, et cetera. But it is an important link, and so we just wanted to elevate that to your attention. The other thing is so much of the work that's been highlighted today is in part or led by nonprofit organizations in the region. And so in the Department of Commerce budget, I hope you see that there's a $5 million allocation for the Nonprofit Shared Services Support Program. That is an important piece of capacity building and support for nonprofit partners throughout the state. We certainly support increasing the power of our sector to be able to address these very critical community needs. And we wanted to make sure that that was on your radar. On just the lower shore itself, Dorchester, Somerset, Wycombe, and Worcester, over 9,000 jobs are created by nonprofit organizations in that region, $695 million economic impact. And so not only being able to address these critical community needs, but also being a large part of the local workforce. So thank you again for the work that everyone is doing. And I'm going to turn over to Pam to highlight some other key information. Thanks, Pam.
Thank you, Erica. And Erica and I have the pleasure of working together on a number of collaborations and initiatives. And so when she talks about advocacy for the nonprofit world, obviously that's near and dear to our hearts. But as you heard, we are such an economic driver in our region, and throughout the Eastern Shore. We need to collectively work together, and especially hard hit. I will share nonprofits, of course, during the pandemic. We're seeing that increase for services, and we're having to step up in so many additional ways when they had less access and challenges. So. Thank you very much for your support of that. A quick thank you to our delegates who successfully passed House Bill 383, which is the Imagination Library program known as the Young Readers Expansion Act. So this is my quick little plea for our senators to also see that through. If there's anything that you need from us, let us know. Here on the Lower Shore, we are the third largest provider of Imagination Library in the state. and we have served over 11,000 children, and nearly, we're getting close to 400,000 books being distributed in the last decade by this program. And the nice thing about Imagination Library is it's showing that children are more ready to learn once they hit kindergarten. We're tracking that data with our school partners. So thank you for your consideration, and we hope that that continues to move through. A big thing I wanted to just do, and if you don't mind, Senator, am I permitted to share screen for about a minute and a half?
You can do that, but thanks for the promotion. I'm still a delegate.
Oh, I'm sorry. I haven't had caffeine yet this morning. So on screen, you'll see this is a page on our website, which is open obviously to everyone. If you're not familiar with the ALICE report, the state of Maryland has done this for several years now. ALICE stands for Asset Limited Income Constrained Employed. This is a free open tool for anyone in the community. We're one of about 23 states that offer this tool, but this is a free tool and comprehensive data set that can help drive a lot of conversations and advocacy and legislation. You can access this on our website, but we have two new things I really wanted to be able to drill down with you. And let's go here, let me open this up. There is an opportunity for every state, but you can come into, and I'll send these links to Delegate Aarons's office so that you can see all these. You can drill down at the state level and be able to interactive dive in. So here you can see where you can pull up that what demonstrates as Somerset County, for instance, is 20% poverty rate and 37% ALICE, meaning that those families are working, but they're really struggling to make ends meet. That's 57%, over half of our Somerset County residents. Unfortunately, they're #1 in the state, and that's not a ranking we ever want to have. But it dives into a lot of information about budgets, how these data points are recognized, and it really helps understand the gap between where poverty is really an antiquated formula. What's interesting too is that we now have an opportunity to do this by legislative district. So in the state, you can come in and for any legislative district, you can dive in and you can be able to go and see that, oh, okay, technology is great till it's not. I don't want New Jersey, but you get the idea. You can go in there and do that. And then there's also a new COVID tracking tool. And so here you can dive down and you can see at the county level, for instance, what's happening in each county for each state. And you can see the disparities and additional information around housing, healthcare, et cetera. So this is a tool available to any organization, any official, any community member who is interested. I want to, certainly I'm not going to dive through the whole website for you. I will send those links, but I really encourage you to dive into that data. Community Foundation has been an incredible supporter of this, as have many of you. And it's great data and tools. We have 3 new focus areas coming out here shortly, one on children, another one on disabilities coming out in July, and another one on veterans in the fall. And then the next release of the full report will be in early 23. It was unfortunately delayed, of course, because of COVID. So any questions about how to access that? I will send those links over.
Well, you know what, I will reiterate something. I said promotion. I was probably going to get a lot of flack from my fellow delegates on that, but each and every one of our senators were delegates, and I figured they must have saw something on the other side. I do think we have a question with Senator Carrozza. Senator.
Thank you, Mr. Chair, and I so appreciate my my time in the House of Delegates. You know that. Anyway, very briefly, Pam and Erica, thank you for the way you partner together, because the information, if you've ever sat down and really gone through one of these ALICE presentations, you realize how much information is there and can inform some good decisions. And my question is to Erica, based on this information through the ALICE data and with the pandemic, you're in a position where so many awards are coming out of the Community Foundation. And sometimes those $5,000 awards make all the difference in some of these smaller organizations. Is there any one area, especially with the pandemic, that you've been really able to see the most impact with your awards?
That's a great question, Senator. Thank you. And Pam and her team have done a great job of both engaging us as a supporter, but also using that data to help inform and guide our board and our committees. And I think what I will say is we still have a number of targeted areas across education and workforce development, but what that data does is it really lets us see where the major discrepancies are and where we can leverage additional funding. And I think that's what's been important. Most of our awards are relatively modest, but it has helped us to be able to identify funding partners and show them what the need is in our area. We're relatively, low population density compared to some of our peers in the state. But what ALICE does is really give you a strong visual, and it's helped us to leverage some of that additional donor and partner support. We do see needs that have been highlighted today specifically, but especially in those underserved communities that ALICE elevates. And it shows you how many people are in the middle. That's where the struggle is so serious, because they're beyond the need for the safety net services, but they are not sustainable and self-sufficient. And those are really, really vulnerable populations in our community. And Senator, I just want to also piggyback on something you said earlier around doing work now, but also preparing for the future. Each session brings opportunity. And I know our Lower Shore delegation is working with two of our colleagues at United Way and Community Foundation to do a post-session event on May 20th. And so we're going to reach out to you next week and confirm those details. But thank you in advance for being part of that wrap-up and pre-planning.
And to Erica's point, I'd just like to interject that we also did release a benefits cliff study to really go into exactly what Erica was just discussing. And we do have additional data points available that talks about that disparity between Black households. In Maryland, the average is 39% of families or households are considered ALICE, but when you dive down, 50% of Black households are considered ALICE, and that is, that has risen 9%, whereas white households declined by 1%, from the prior report. And so there's a lot of ways to dive in and help frame your work. So thank you very much.
Thank you. I think we're going to start losing some people because we start at 10, but a couple things real quick. I just want to mention to everybody, this is our last regularly scheduled meeting, but keep your emails live. We may do something in a week or so after crossover's over. And I do want to let everyone that presented today know that if they do need to contact us with some important information, and I apologize for it being short and the questions not being asked, but please feel free to contact any one of us. We'll address those needs. Moving forward, again, thank you. I'd like to address I'd like to get to our recognitions of our federal delegation. Do I have any updates?
No update from me, delegate. Another great meeting, very well run, and you're very fast.
Thank you. Anyone else? Melissa?
No, I don't have anything. Thank you, sir.
Okay. Are we done now? Is Ms. Cradaville out there? Okay. All right. You know what? I'll tell you what. I'm going to probably just pass on this, and I need a motion to adjourn. And thank you all. Do I have a motion?
Motion. Second.
All those in favor say aye.
Aye.
Aye. Thank you.